Over to you, ma'am. Please start. Dr. Sucheta.
Yes. Good evening, everyone. A pleasure to meet all of you again today. Before Dr. Nibriti starts with her talk, I thought we could just share with you, all of us are here, exactly what we have in mind as far as this course is concerned. You will see on the screen, you will see the timetable that we've already posted to you. And we have given you the competencies and broken you up into groups, you will notice. And the timetable is there, and each and every day what is going to happen is given to you. So today Nibriti is going to talk on MCQs, MEQs, LAQs, SAQs, etc. That means the question and answers. Then on 27th we will have integration and the ADCOM model and a little bit of feedback. And finally we will have some people talking on ECE. So we've chosen topics which we have to introduce to the students as part of the first professional course. So by the 3rd of August, by the 7th of August, sorry, we will have finished all those topics that we think would be of interest to all of you. On the 3rd, Dr. Pragna will not only do SDL, self-directed learning, but she will also do touch a bit on interactive teaching. Once that is done, you will then start working on each group. Let me share the other the other screen with you. These are the groups that we have. So the nine people are in group 1, are in group 1. Then 10 to 18 are in group 2, etc. And we have already given you the competencies that will be done by each and every group. So what we expect that group to do is they will work on the standard learning objectives. They will find out in the topic that is given to them which topics they can use for ECE and which topics they can use for self-directed learning. So it is the group that is going to work, and in the Google Classroom, Dr. Bedi has given you these sheets. So each group will start filling up these sheets as and when they have the time. Group 1, 2, 3, 4, you have very little time as compared to, of course, the other groups, the groups in the end. So we will have to see that all of you work in cohesion. And group 1 and 2, please be careful to understand that on the 10th you will be presenting your SLOs, the topics that you will talk for early clinical exposure, and the self-directed learning topics, along with a few of the MCQs or the SAQs that Dr. Nibriti will talk about today, which are, you could choose one topic and you could prepare a question on case-based learning or problem-based learning, as will be evident to you by the talk of Dr. Nibriti. So this is the whole scenario. I hope all of you have understood this. I will not take any of more time. This was just to sort of sensitize you to see what is it that we really expect from this group. And as you start putting the your SLOs, etc., on the Google Sheets, we will keep having a discussion over there in the Google Classroom. If you have any other questions to be asked, please go ahead and ask us or ask Dr. Sanjay Bedi. He is the main sutradhar of this entire course. So with that, over to you, Dr. Nibriti. Thank you so much.
Thank you, Sucheta. Now I think I want the screen to go so that I can load mine.
Yes.
Okay. You show my screen, so I'm showing my screen right now. And Sanjay, you tell me that yes, it is done. It has come. My screen has come. Hello?
No, ma'am, not yet.
Can you hear me?
Yes, I can hear you. Screen has not come.
I have.
Yes, it has come.
It has come.
It
No?
has come now. Yes.
So I can start.
Now
I can
go.
start with my talk.
No. Now
Okay.
you go to the full screen slideshow.
I
Full
will
screen.
make it full screen and start with my talk, right? I make
Yes.
it
No,
full
go to
screen.
slideshow.
No,
Go
it
to
is
slideshow.
okay. I think I can.
Huh?
Now I can. I will make the full screen. Should
Yes.
I make the webcam?
Yes,
Okay.
ma'am. You can.
No one can see you. Click to share your webcam. So no, it is not. Again, it is not working. Perhaps
It's
work,
working.
perhaps will not.
We can
Okay.
see you.
Okay. Yeah. Right. So that is to be hidden.
You just.
Okay. So it is a good evening. It is very nice to see you all again. So I will start with my talk. I have three consecutive talks: case-based learning, SAQ, MEQ, and MCQ. So now I will go over to my talk and let me start with it.
You can sit,
Oh,
ma'am. You
I
can just
because
bend
that
the
is my habit.
laptop. Just bend the laptop a little bit.
Yeah, bend the laptop a little bit and sit.
I know that. But where is my screen?
The screen is there.
मैं webcam को हटा दूं? Hide your webcam. Okay. Once I hide my webcam. Why it is not hiding? I'm trying to hide my webcam and it's not hiding.
Okay.
Ha!
Yeah.
Now it is.
Yes. Now go to slideshow.
Yes, I can go now. No problem. Webcam closed by organizers. Done. I hide the panel. Unlock the control panel. Hide the control panel. Right. So friends, I start with my talk.
Slideshow. Put it here. Make this here. Yeah, this slideshow.
But it is not moving. Why it's not? Right. So this is me, Nibriti Das. So
It is.
just very quickly going through my own introduction.
Dr. Nibriti, make a slideshow.
Can you share?
Slideshow नहीं आया.
Slideshow नहीं आया.
मेरा तो दिख रहा है.
Here, press this.
मेरा तो दिख रहा है पूरा. Is it coming?
मैम आप escape button दबाएं जरा.
नहीं आ रहा है.
आप escape button दबाएं. Escape button. The screen has got locked.
Why?
Just tap on the main thing.
फिर से screen share करूं क्या?
नहीं स्क्रीन मत शेयर करें. ये पावर पॉइंट को बस रीस्टार्ट कर रहे हैं.
और कौन तो it is here तो ये दिख रहा है. Restart कैसे करूं?
मैम escape button दबाएं ना. Escape. Just press the escape button.
I don't see any escape button. End show करूं?
At the corner of your keyboard.
हाँ वो तो मैं समझ रही हूँ. तो end show कर दूं?
हाँ end show करके restart कर लें.
हाँ end show कर दूं. End show कर दिया. Now I start.
Yes ma'am.
So I am
आपकी
starting.
स्क्रीन लॉक हो गई है.
लॉक हो गई है? अभी भी लॉक है?
हाँ अभी भी लॉक्ड है.
Madam, your cursor now just go and just do this to your cursor. You know, just tap the cursor on the screen.
Okay.
Double click.
Double
click on the screen.
Is it coming now?
And now you go here.
Okay, let me do the slideshow. Yes. But my screen is absolutely blank.
Share screen again.
Okay, हाँ मेरा ख्याल है वहां से वो हट गया था. So is it seen?
Yes, click on it. Yes, it is seen.
Should I?
Now,
It is
yes, you. I
It is
hope click
saying?
on it.
It is
Yes,
okay. I think
yes.
now I can start the slides. Okay.
Yes, yes, ma'am.
But we
Maybe
don't
it will
see the
get
slide. You see the
मैम उसको
slide.
ऊपर स्लाइड शो है ना, स्लाइड शो को दबाएं.
स्लाइड शो
वो
को
तो दबा
दबाएं.
लूंगी मैं, वो तो दबा लूंगी मैं, लेकिन वो शेयर हो रहा है ना, ये जो पूरी स्क्रीन देख रही
हाँ, हो रहा
है.
है.
ओके, क्योंकि एक बार दबा लूंगी फिर वो मुझको दोबारा लाना पड़ेगा. So that is the problem.
कुछ नहीं होता. हाँ.
No, now it is done. Is it done?
Very nice.
Yes.
Beautiful. First class.
Right. Thank you. So we are all teachers. So there are certain attributes of teachers that we all know and certain responsibilities, and we all have been doing that. But with the change of time, certain roles of the teacher and also the educational system, there are certain changes, and therefore we are here so that we can adapt very well with that. So case-based learning as a strategy of UG medical education. Let us look at the objectives. After this session, we expect to be able to define and explain the concept of case-based learning, list and explain the desirable educational objectives that can be achieved by case-based learning, list and explain various strategies of CBL, explain the merit of small group discussion as an effective strategy for learning and a vehicle for student-centered learning aimed at achieving the desired competencies. Explain how use of clinical cases facilitates various attributes of learning for a medical undergraduate. And critically appraise the merits and demerits of different case-based learning strategies that can be used and their effectiveness in achieving the educational objectives of CBME. List the essential attributes of a teacher to serve as a facilitator of learning and his or her responsibilities to facilitate learning using a CBL module. List the responsibilities of the learners to optimize the environment of effective CBL. And there are performance also on our part. Frame the modules of different strategies of CBL and use such modules to facilitate students' learning. Plan up a schedule to incorporate CBL in the existing teaching timetable in the respective college, because every college will have its own limitations. So it is also desirable that you are able to state the limitations of the strictly discipline-based teacher-oriented medical curriculum from the students' and educators' point of view that triggered the need of paradigm shift in the medical curriculum over a period of last 2 decades. There are many publications, that is self-directed learning, and also MCI also explains it very well. So let us start with the case. Once we are talking of the case-based learning, so it is the case of baby Naina. So baby Naina, a 6-week-old girl, was diagnosed for viral gastroenteritis. When she had diarrhea and vomiting, she had been breastfed till 6 weeks of her birth and had been in good health. Then after she was given a food supplement and breastfeed was discontinued and the mother suffered from an infection. What I want you, I am revealing it slowly so that by the time you also keep thinking with me as I'm revealing the case. The infant, after management of the crisis, was discharged and was recommended a new fortified food supplement which contained sugar instead of lactose. She improved and started gaining body weight. Just to try, she was given the previous formulation again in between as it was cost effective. However, she developed diarrhea and vomiting again, refusing the feed. Stool examination showed presence of reducing sugar. This supplement contained lactose. Just think, and you can note down also what you are thinking of this case. Since she had no problem with breastfeeding and other two siblings were perfectly healthy, an inherited disorder was ruled out. Her problem was diagnosed as secondary lactose intolerance, which developed due to damage to the small intestinal brush border because of viral gastroenteritis. So these are some of the tasks. I'm not telling these are assignment for this package, but yes, once you have seen this case, you can try to identify the competencies and frame SLOs for which this case can be used to facilitate the relevant learning. You can use this case for making framing a module for your own college and teaching the students. So as the teacher says, you go and do this. So I'm saying that. Case-based learning is a pedagogical method that uses case studies as active learning tools. What is a case study? You have just now you have seen a case. A case study is composed of an engaging and or controversial story, because as the teachers were going, there must have been some confusion in mind. What it can be this, it cannot be this. Usually a dilemma that requires a basic understanding of scientific principles. Here our role are very important. Qualitative studies of case-based learning methods suggest that students comprehend concepts, retain content longer, and achieve critical thinking and real-world problem-solving skills. Some references I'm giving side by side. So, what all educational objectives that we want students to acquire possible with CBL? So structuring knowledge for use in clinical context. Naturally, we expect our students to structure the knowledge he gains to be able to use that, and going by competency based, this is the essential part. Development of an effective clinical reasoning process. The development of self-directed learning skills, as Dr. Sucheta said, we are all our lifelong learners, and medical professionals are definitely, today there is a COVID, yesterday there was a swine flu, and so on and so forth. So they are learning, and that should be inculcated right the day come to the medical college. Increased motivation of learning. So there are certain strategies. Each teacher can have his own strategy, his or her own strategy, once a case is there. So I have shown you a case, but there are certain documented strategies. So these are case-based lectures, lecture-based cases, case methods, modified case-based method. These are two more which are practically problem-based. I'm not touching upon that because one needs more of experience, more of expertise, more of skills, and making problem-based produce and handle the students in problem. We need skills. So case-based modules are easier and acceptable to most of the medical college who want to adopt to case-based learning. So one strategy is case-based lectures. So perhaps just now you have experienced that cases or cases are presented before lectures to highlight material to be covered. And when I showed the objectives, there were four things. One, structuring context, the critical reason, development of critical reasoning, then motivation, then self-directed learning. So remember these short forms. So these attributes can be achieved to some extent once you start your lecture with a case. Immediately students get very attracted, particularly the first year young ones. They just feel they are almost a doctor when they start studying patient case. Second is the case method. Students are distributed in groups and given a complete case for study and research in preparation for subsequent class discussion. So here, naturally, they have to acquire their own knowledge. They have to make it structure it for a clinical, because clinical situation we have given. They have to have critical reasoning process, and they will have good motivation. Then there are another method, which is sorry. Now there are lecture-based cases. Cases are used at the end of a lecture to demonstrate the relevance of the information in lecture. Suppose all the lecture is taken, then ultimately you show a case and just tell them, yes, this is the case, so you can be able to relate that what I have taught. So the different actions are not. Yes. So here we questions. Although the basic thing is that end of the lecture a case will be shown. Take a short lecture for 20 minutes or so. Some people practice that, I have found in the, and we have also done in AIMS. Display the problem that distribute the students in small groups in the same class. Tell them to identify the case using their understanding from the lecture, and also let them define their learning needs to understand the biochemical concepts involved. Tell them to make few questions, prepare and present in the next session. Complete your lecture, whatever you have left. You have given certain salient features, then only you have given the case, and complete your lecture in the next session. So now the case method, students distributed in groups are given a complete case that is done. Now it is all going back. Okay. So students are given a complete case. This is the case method, as I told you. So here, for just to help you, just to take home something, I'm giving you another case on which you can work. This is the case of hereditary fructose intolerance, which is a life-threatening inborn error of fructose metabolism. You just have a look at this. I will not really take too much time reading through it. You can have a look, and I just wait for you to have a feel of this case. You can work on this. You can do lots of things with this case, and you can complete it as it suits you. You can make it shorten also if your college doesn't have much time to take a long case, and so on and so forth. Now there is another activity which is perhaps most of the important attributes, but is comparatively needs more skills and more patience. This is the method often used in the new medical schools that feature PBL. I mean, they started with PBL, but now they want this. The problem formats are employed in small tutorial groups. Students do not have totally full and free inquiry, and there will be tutoring in the problems. Students are, as in the problem-based schools, students are free. Here, total freedom is not there. Also, students are not required to actively apply the results of learning. So, but here, all the attributes are very, very, very high. So once I said this is the method often used in the, okay, the problem formats are employed in small tutorial. What is this problem formats? What is case? What is problem? That often confuses. When we speak of case, we give almost all the necessary details of patient when she is identified as a case. And problem where you just give the first patient comes, and slowly as the doctor goes interrogating the lab reports and so on and so forth, this is revealed slowly, not all at a time or fast as I have done while giving you the case. So again it is going back. Now, so the modified case, each trigger will be given one by one. I say trigger, suppose these are the triggers, trigger 1, 2, 3, 4, 5, 6. I will not use much of mouse because it disturbs. So each trigger will be given one by one, either as a paper cut simulation or displayed on a screen. not all together, will be discussed by the students in groups, guided by the clues or questions from the facilitator. First, students, let them discuss for some time, then you intervene in between, put some questions, ask them for some certain clues if they are getting. Like that, the facilitator facilitates the discussion. Learning needs should be identified by the students. The procedure is like clinical case solving, because once they're discussing, most of the time they will say, but I don't know anything about it. Immediately it becomes their learning needs, so they can note it down. So this is a case. You can just go through these triggers. My mouse does lots of mischief, so I don't want to use it much. Her parents and 8-year-old brother all looked healthy. On further examination, her abdomen was slightly rigid and tender on palpation. Although we are not supposed really to give any answer, we are only to facilitate the discussion. But students get really quite confused about this rigid and tender. So either with examples, with something you bring them, that what it means by the rigid and tender, or one can tell that much. Lab investigation, then it comes to the lab investigation. After lab investigation is done, it is going on where the biochemistry has a very important role. So ultimately, the girl was diagnosed for sickle cell anemia and parents was born. So how to make a module while you are making the students to discuss? What is done? The student is given only the trigger. Rest is framed by the teacher or the facilitator along with discussing with the residents, other faculty members. So which cues and discussions are needed, that will depend on the objectives that you have made. And like that, some examples that you can just in between go and ask, what is color? What could be the reasons? What is yellowish discoloration? But don't take a slip and one by one asking question. Never to do that. Just go down the discussion group, just throw a question and let them discuss. So this way, I have given a list of clues or this that can be used for this case. Then the trigger 2 also have. This is the whole module is framed by the teachers. Students get only the triggers. So here also there are clues and discussion points. Learning needs are generally, you have to bring the students to identify the learning needs. If they do not come to those learning needs, one can ask the question, do you know what is meant by hemoglobinopathies? Then they will say, we don't know. Okay, that is your learning need. So like that, one after another, the trigger goes and teacher gives clues and questions and facilitates the discussion, but never tries to overpower them. Just observe them, just make a small question in between, as it just like a partner to them. So this is a wonderful case, in fact. Lots of biochemistry, lots of protein biochemistry, lots of genetics, everything can be done through this particular case. So just have a look. I won't spend much time because some time has already gone, and you will have all this material with you. And can very well work. You can make it very small if you have not much time. If you can expand this further, if you want to carry it for 2 sessions for 2 days. So here I am trying not to take a class or lecture, trying to give you certain tips and certain guiding points, and that's it. So the whole case has given like a problem, and here it stops. And by this time, students almost get through the full case. So the process: patient case presentation, students discuss in group, identify cues, reason out all the possibilities and learning needs. Here the teacher facilitates, collect data, decide the case, learn what they need to learn, the learning needs. Teacher very subtly take them to the learning needs. But they feel they have identified, so they cannot say, ये क्या पढ़ाते हैं, क्या हमको क्या फायदा, and so on and so forth. It is them who found out the learning needs. So now quite a big bulk of the teaching is going to be student-centered. The pedagogic shift from traditional teacher-centered approach to in which the emphasis is on teachers and what they teach, to a student-centered approach in which the emphasis is on students and what they learn, requires a fundamental change in the role of educator from that of a didactic teacher to that of a facilitator of learning. Teacher is there and teacher does everything, but he should be so subtle that he just a facilitator, not another. Then students get scared. Their own potential never come out once teacher is taking every authority. So let us speak few words about small group discussion. Any instructional method involving small group of students in an appropriate learning context. It is the MCI document which describes small group discussion like that. 8 to 10 students take part in interactive sessions supervised by a facilitator. This under the limitations of the feasibility can be changed. This number can be changed, the space, the number of facilitators, everything, it depends how you organize this small group discussion. The students are given well-defined objectives which they achieve by working as a team through discussion and referral to resource material like books, journals, and internet. The facilitator's role is to ensure that learning outcomes are attained in the prescribed time, to keep the group focused on the task, provide appropriate resource material, and maintain discipline without trying to dominate the proceedings. And you generally in the group activity, you choose a leader, you choose the person who summarizes, you choose a timekeeper, and a leader can be made by rotation so that every student feels drawn to it rather than one leader remains all the time a leader. The most vocal students can be made a leader, saying that you now lead the group, but your own ideas will come the last. Let them speak, try to draw a brevity. The most shy student also, you can do the same thing, make him a leader. The shy student ultimately starts opening up. So attributes of small group discussion: working in teams, critical thinking and analysis, explaining concepts, applying course content to real world examples, self-directed learning, oral and written communication, managing projects and holding leadership roles, self-awareness and evaluation of group processes, working independently, researching and information literacy, integrated holistic learning across the disciplines. Both the cases you will find lots of scope of integration, or all the three cases. Now, case-based learning. What are the attributes? Early exposure to patient's problem, greater motivation, critical reasoning, integrated holistic learning, self-directed learning, learning the needful, teamwork, leadership, decision-making, clinical case. If you see case solving, if you see the small group discussion attributes and case-based learning attributes are quite complementary to each other. Therefore, small group discussions gives the optimal environment for case-based learning. So the role of the tutor is to facilitate the discussion in the desired direction of learning and elicit optimum response, coordination, cooperation, participation, and reasoning from the students. Tutor's role should also be that of a student's friend who will be able to facilitate learning by realizing strength and weakness of a learner at the individual level. Small group discussions provide ample opportunity to observe and understand the students. The tutor should also give the feedback to the students and receive the same from the students. The success of CBL to a great extent lies on the attributes of a tutor or facilitator. So it is in front of you, so you can see attributes of a facilitator, because that is the most important thing in small group discussion. So good communication skills and comfortable with students. Humor makes the session. Once students discuss, You find so many things where you can crack a small joke, they laugh, they will have fun, then they work, they learn. Participates in the discussion as a participant, not as an authority. Once you drop this authority aura, we become very good facilitators. Facilitates discussion by raising leading questions, challenging students' logic, and drawing everybody to the discussion, but should do all these in a subtle way, masking his or her authority in the area or as a teacher, should restrict him herself from displaying his or her own knowledge in factual details. If you are comfortable, you can easily say, I don't know anything about it. You have to find out. Nothing happens. No student thinks you are a fool, but can always triggers logic and help students come to logical conclusion, but only if needed. Encourages students to discuss amongst themselves, rather allowing them to treat the tutor as the key person to whom they need to convey their analysis or look at for factual information. Simply leave the discussion group. Say, I'm going, you discuss, I'm not going to answer anything. At the end, the tutor can help the student leader to summarize only if tutor's help is needed. Student leaders should take help or data on discussion from the students and also from the tutor as the last option. Should listen to all with patience, but should keep the discussion within the track. Should be very alert to contribution being made by each of the students, especially to those who are comparatively less vocal. Because often happens from a corner, a student speaks something, murmurs something. And if you had an ear, you will find she spoke a very important point, but was hesitant and shy. So we are not supposed to miss those small things. If you have picked up that small little murmur from her, she gets more confident for the next session. Create a congenial interactive learning environment. Should be able to keep him herself aside and get back into discussion off and on in an effective manner to avoid students' sensitivity and hesitation in discussing amongst themselves freely in the presence of a teacher. So idea is that you have to solve this problem by yourself. You can't call a teacher for support. So the students' role, that learning is active, not passive. Student is asked to perform, think, get involved, commit himself, and learn by trial and error. He is asked to learn both cognitive reasoning skills and the psychomotor skills of interview and examination, and to identify learning needs made apparent by his work with a clinical case. So these strategies just didn't develop just like that. A very thorough, in-depth work on the learning principles, which brought forth all these different strategies. So just have a look to these two panels. One is talking of the learning principle, another is talking of case-based learning. Learning is a holistic process, provides an overview before proceeding to specific deals. Learning is enhanced by with explanation, failure analysis. Once they are not able to answer or something, yes, they get the feedback. Learning is a constructive process in which a learner constructs knowledge from external information, provides for maximum participation, interaction, and collaboration. So, this is a very sound education strategy. So, the highlight of this talk is in the context of medical education. It is a clinical problem that serves as a vehicle to promote, this is the central point, which vehicle promote immediate contextual learning of a subject, which can be applied in the real life situation. Small group discussion provides the optimum environment by undergraduates, ensures better motivation, critical reasoning, self-directed learning, and active, meaningful, long-lasting learning started and applied in a real life situation or clinical context. Teachers
Hello. Ma'am, net connection is. I'm just calling, ma'am.
अभी पता है वो नेट आ गया, अभी नेट गया था, अभी आ गया। मैं फोन से कनेक्ट करने की कोशिश कर रही थी, फोन हाँ आ गया। अभी मैं फोन से कनेक्ट करने की कोशिश कर रही थी, फोन वाले वाईफाई से।
ओके, आ गया।
हाँ आ गया, लेकिन वो कौन सा ट्रिगर था, हाँ जिसको स्लाइड शो में जिसको मैंने रखा था। Yes. So, our patient is nowhere. We expect that after the 4th year, they will remember everything. Whereas if the practical exam is later, after 1 month of the theory exam, they don't do well at all in the Viva OC. So they forget immediately. Here, the patient problem, teacher gives a student a patient's problem. They find the learning needs, they get interested. In fact, it is contextual. They feel they are to be doctors, so they should know about the patients. And then they learn from various resources. Teacher can also be a resource. A lecture by teacher is also very welcome. So again, I'm not saying it is one of the assignments, but yes, if there is something which had been useful here, so do for your own choice of CVL modules of different categories, whichever you want, whichever you feel in your college that is possible. And the module should have a clinical case, the procedure, the cues for discussion, learning needs, and SLO linked to the competencies. Very well, you can document it as your own contribution in your college. So how to really link the case with the competency and SLO? This is an example about the sickle cell anemia. Suppose what I just found that these are the two competencies which can very well be taken with a sickle cell anemia case, and certain SLOs are made, but it is not complete. You take it home and complete it. So this is the experience of a teacher, Burroughs, who has lots of papers on case-based learning. On a feedback from a student, she found, I sleep throughout most of my biology lectures. My professor tries hard, but I just get tired of listening to so much information. I think you are tired, but I can't help it. But this is where a teacher started feeling that what are we teaching if the students are sleeping? Rather than why the student sleeps, why he doesn't listen. Naturally, we can't make him listen. So these are some of the points: the dissatisfaction of the learners with the education, the irrelevance of the learned information to the professional practice, the learner's lack of reasoning, which started with the use of cases, whether as a problem-based learning or whatever it is, long back in the McMaster's University. And most of the principles still are taken from that. So, no more sleeping, cheer up, work in group, decide how will you proceed, which all information you will like to gather to elucidate the case, complete the module with learning needs, points of interaction and discussion with your students, and also linking with the relevant competency. So I must thank you for this didactic lecture, which I hardly take. But yes, this platform is new and limitations are also there. So I just give you 2 minutes to rest or jot down your questions, which you can take home, can work in the group. Still, if something remains, which you really want me to explain or any of your teachers to explain, yes, definitely in any of the discussion sessions, come with those questions. Those will be given. If you want another small explanations on any point, that will also be done. So, hope you have rested, and I start the second phase. So assessment, SAQs, and MCQs. Objectives of the session: Delineate the scope of short answer questions and modify structured essay questions as the assessment tools in medical education. Frame different types of short answer questions. As Dr. Sucheta said, you have to make the questions. Use short answer questions to frame problem-based questions and structured modified essay questions. So short answer questions aim at greater course coverage, greater objectivity. A short answer question is so framed that it demands very short answers, a single word to few lines from the students. Shorter the desired answer, greater is the validity and reliability. So although it is gone, it doesn't matter. So designing of SAQs. Types of SAQs, this is the first one of the first one, that is practically fill in the blank. We call it as completion type. So this is an example. So this is another example. Look at this. Answers are absolutely specific. There cannot be any two answers for that. Again, this is very, very specific answers. Now, again, some examples. These are the examples, so that makes you, that facilitates your making short answer questions. Answer should be very specific as much as possible. So these are some of the examples. Now there's another type. So we have covered single completion type, multiple completion type, now unique answer type. Here a direct question is asked. While framing, it is to be remembered that question invites very specific answer with no other option. Suppose list in the sequential order the steps to be followed while passing a Ryle's tube in a conscious patient. There cannot be more different steps. It is impossible. Name the vitamins required during the conversion of glucose to lactate in the glycolytic pathway. Perhaps the whole of the glycolytic pathway is being asked with this question, but this question is very, very, very specific or numerical questions. So again, this is another. So you can have auspice like that. So there are open SAQs also when it is not as stringent. So suppose enumerate the clinical features of cretinism. But how make it more specific? Enumerate the clinical features of cretinism in the neonatal period. Define an essential amino acid giving a suitable example. Draw a diagram and label diagram, that is much better. Open SAQ, enumerate any three causes of anemia. Any three you are saying, you are not making causes of anemia, then it is not short, it can be very vague. Compare red and white muscle fibers. Draw, compare and contrast is very good way of asking SAQs. Draw a level diagram of neuromuscular. Some anatomy physiology is coming. I kept it because integrated learning, perhaps a little bit of integration of knowledge is also important. For anatomy, I think very good. I mean, this draw a label diagram is very good. For biochemistry, also certain questions can be made like that. Now, combination of different SAQs designs in a single question. It is practically designed by us. There is nothing written like that, but it is very interesting. I feel it is very interesting. It is an electrophotogram. The origin chylomicron is given. The band spaces are given. The density is given. Now you have to label 1, 2, 3, that what they are. The type of lipid circulating in higher levels, there is one which is in higher levels in the patient as compared to normal subject. Name the apolipoprotein or its receptor, that is because the LDL and LDL receptor are the same. HDL receptor, those are the same, is defective in this case. So this is, I think this is a nice question. I'm too happy because I made it. Most of those I made it. And this another question. Look at this question. If you don't go to the fourth point, perhaps you do not know how to do and what to do. You get some clue from the third, but you have to know the whole thing to answer this question. So this is also a good comprehension type question asked by SAQ. So essentials of framing SAQ. Stage 1, select the topic area, decide the level of cognition to be assessed, choose the most appropriate type or design. I mean, you have to be sure. Which can be done by single completion. Why do you make a huge case out of that and then ask a question? So think for which type of answer you will choose which type of SAQ. Think of the answer first. This is essential. Without thinking of the answer, take a book and you can write any number of fill in the blank. But that is not important. Important first you think what you want, what knowledge, what competency you want from the statement, and then frame a question, and then make it specific. Frame the questions in simple language in a way that the student should have no confusion about what is being asked. Prepare the checklist, model answer, mark weightage, and then evaluate the validity, reliability, feasibility of the questions and give a proper layout. So that is another area which we cannot touch now. Now, use of appropriate action verb, as Dr. Sujeta also said while framing the objectives. So which I have made in cross, these are not to be used. And which I have left open are the verbs which are the best verbs to be used to frame an SAQ. In green, I have made why, what, why, how. The reason they can be asked, but they are not action verbs. Therefore, they have got another color. Better to give specific instructions so as to make the question quite clear. Suppose write in 2 lines, list 5 causes, list 3 essential symptoms, and so on and so forth. Avoid giving clues because it is also a difficult part. Many a time it is very difficult to avoid giving clues while meeting a question. How is SAQ different from MCQ? SAQs demand answers from the students which they have to search out from their knowledge bank. In MCQ, as you all know, answers are all provided. Only student has to choose one. So this is that example. That the same question I made in SAQ as a fill in the blank. Here in MCQ, the student has not to find out anything, only he has to tick one. Demerits of SAQ: takes more time to correct. Open SAQs have less reliability and needs very careful preparation of model answers and checklists. Test lower cognition level as compared to essay type questions. Now essay. What do we generally expect out of an essay? A student will write an introduction, a definition, which is recall and comprehension. Facts with full description, recall, comprehension, organization. Discussion, analysis, evaluation, summary and conclusion, synthesis. So with essay, you can really assess the lowest to the highest level of cognition. But for lowest level, we have so many other things. So essay should be used only for the highest level. What is the problem? So essay type questions have a distinct place in the assessment of cognitive skills. They are primarily used to assess learning outcomes of a higher level. Because if you can have more objective questions for lower levels, why should you go for an essay? Now, what is the problem? Suppose one asks, write an essay on glycolysis. A student can write lots of blah blah, very beautifully language, very beautifully paragraph, very nice organization. That is one acumen that is tested in essay, but not the facts or what you wanted the student to write for the essay. So no objectivity, no nothing. And generally what happens, we really don't look for the organization. We just, somebody given the whole marks after pages, he gets the marks. And the glycolytic pathway, so these are just like that. Nothing is sure what you use in your mind, what is in student's mind. So suppose write the reactions of glycolysis. What do you want? The steps with enzymes, coenzymes, modulators, regulation, or just the steps, just the enzymes? Nobody knows what is in your mind. Now, short answer question, short notes are definitely not the best thing to ask, although it has place. Short notes, nothing is clear what is the short note. Students generally try, if they have time, try to fill in pages. And one gets more marks who has filled in more pages. That is also another problem. So improving assessment through essays. Low reliability, structure the essay. Low validity, include more short structured essays. Low objectivity, make MCQs, that is structured essay questions with checklist. Does not test problem solving ability, make problem based SAQs. Modified essay or structured essay questions. What are they? Break the traditional essay question. In your head you will have an essay question in small questions and not specific answers. So this is an example. You just have a look at that. Reading will take time. So this is describe the reaction, regulation and functions of glycolysis. You can easily break it. And what you wanted really student to show their knowledge, everything can be asked if you can break it in short answer questions, and it will be full essay question of what you want to know. And each one is very specific. Another question, write an essay on biochemical logic of fructose intolerance. Define, is it an inborn error of metabolism? It comes as an error. State true critical symptoms that is observed in patients with severe fructose intolerance. Write a single most important biochemistry laboratory test finding observed in a patient with fructose intolerance brought to the hospital emergency. State the structural similarities and differences between glucose and fructose as per classification of carbohydrates. So see how many competencies it is testing in small short answer questions. So it completes an essay on fructose intolerance in small bits. Merits of SAQs over essay type and MCQs. More reliable than essay questions, easier than MCQs to frame, cover more test items, if not course contents as compared to MCQs. If meticulously designed, high levels can be tested, possibilities of guesswork minimized. Higher levels of SAQs can also be fair, problem-based questions, interpretation of data or graphical presentations, numerical problem solving, comprehension of knowledge, modified essay questions. Effectiveness as an assessment tool, reliability good, validity good, feasibility good, excellent in assessing the recall of basic vocabularies, can be made effective in assessing higher levels of cognition, but not synthesis and evaluation, used effectively while structural and essay questions. So one can make a checklist to see how good your short answer question is. So these are some of the points here. Only one point which can be a bit confusing is the third point. Has textbook language been avoided? So one gets confused. What does it mean? In fact, it means that questions which are there in the textbook after a chapter, one should not just take it and give as the assessment question. At least language, because material has to be the same. Students, you are teaching from the book, students are learning from the book, but the same question should not be repeated in the same language. So with this, I finish this part of my talk. And just I will feel a little gratification if you really can make some nice MEQs and certain good SAQs as the assignment of Dr. Sucheta. And if any problem, any question, you can always ask me later. And coming to the MCQ, it is the shortest and sweetest. Objectives of the session, just go through it.
Yes.
So what is the multiple choice question? It has two parts, a STEM and alternatives. Merits, highly objectives, model answer, easy to make. Good course coverage, easy to expedite as an assessment tool, especially when number of assessees is large. Limitations, you cannot really go beyond comprehension. So certain tips: don't use the words like never, all or none, only, and like that, because that gives hints. Avoid overlapping choices. Make alternatives clear and distinct. And mutually, don't try to confuse the students by your writing of the MCQs. Now, avoid questions of the form, which of the following statements is correct? It doesn't mean much, because students, I have seen those very genius type of students, they will get a long extrapolation and say another choice is why it is not correct. This is this is correct. So which one of the following statements is correct, rather than which one of the following statements is the best answer. That is the best way of framing an MCQ. So some examples, you just go through it. I will not read. If you see, once I'm using the options as in capital, I'm putting a colon. Once it is a continuous sentence, I'm making it in the small letters. And another thing, one should avoid asking negative stem or negativity questions as far as possible, and double negatives are never. So you could have made the last question is which one of the following is not true, but avoid that. You can always say all of the following statements are true except, and highlight such questions with capital, because students get a mental frame, they keep on answering, and often they miss that it was an except that was asked. So make it clear to them. So look at this question. It is really needs higher level of cognition, reasoning, and conceptual understanding. Very difficult as such. Now the last question in this page is, if it is a problem, a 4-day-old infant brought to the hospital with the complaint of refusal to feed, vomiting, cataract, protruded belly, failure to thrive. Which of the following is the best assertion to handle this case? Look at the stem. It is not asking which is the correct, which is not correct. So how will a doctor go? Will he just think it is an inborn error of metabolism and start his treatment? No. It is a case of gastrointestinal infection. Just he will think and start. No. A blood, urine, and stool samples should go for lab test. The infant is suffering from lactose intolerance. We cannot just guess. So the best assertion under these options is that sample should go for a lab test. So this is again a problem-oriented, higher level of question which needed reasoning to answer. So this is another concept question. Just 2 minutes. I think I will just take 2 minutes, and that's it. So these are assertion type questions. So there should be one statement, an assertion, another is a reason. So take the example, just the example. The second question I'm giving. So this is another example. This is another example. This is multiple responses. It is difficult. You have to have at least 5 or 6 options. If it is 4, you can have only 2. But it can be framed like this. I do not go for that. I have already described in the example. So with this, I complete this talk, and there's not much time to entertain any question, and it is not needed also. We are all mature faculty. Whatever questions had been in your mind or whatever confusion out of my talk, you can discuss first amongst yourself at home on interact. And once you have consolidated, yes, these are some of the points we need explanation from her. So please consolidate, and any of the discussion session, as Dr. Sujita has planned many, Dr. Bedi has also planned that, you can definitely consolidate and ask from each group. One can ask that these were some of the problems questions. which we wanted to ask you. One thing, the feasibility, how to really manage these small group discussions, yes, that is there, that question has to be there. And there may be a few more questions which I can, but do a little homework, do a little self-directed learning, do a very close discussion, and come out with certain solid questions. It will be answered. You can always mail me the questions if you just like that, if you want, or WhatsApp the questions. You will be and you will be given the solution of that questions. So thank you very much. And so I end my session here itself.
Any questions, anyone? Please raise your hands.
Sanjay, what I felt, let them think about it, because these are 3 talks at a go. So questions can come just like that. But if they really think that then they work on that, then they talk to their group members, and then they find, yes, these are something that we need these answers. Definitely they will.
Yes, ma'am.
That is the adult strategy. Okay.
Okay, ma'am.
If you agree, I felt like that.
Yes, ma'am. Okay.
And if you have instruction, or Dr. Sucheta has some more words to speak, she can definitely. As such, I never like giving a didactic talk, but yes, one has to adjust whatever is the available feasibility. But still, if there is something very strong question, I will not, and there is time, let them ask. I have no objection.
So, can we end it here?
Yes, thank you so much. Thank you all. Thank you very much for this patient hearing. And I hope you will start working something, some message you got out of my talk. Then I will feel really very grateful. If not, please come to me. I will try to help you. Okay, thank you.
Please create your own WhatsApp groups of your own subgroup.
Yes, email group, WhatsApp group, so that if there is an email, I can give it to the group. I cannot individually. Let them make their WhatsApp group, interact, come out with certain things, and it can be discussed. It can, therefore, lectures have been kept like that, so that on discussion we can spend more time over the lectures. All the talks, therefore, are made comparatively crowded. So bye. So I say bye to everybody. Thank you, Dr. Sanjay. Thank you all the participants, and thank you participants. I won't say trainees because I'm getting some training from you all. And Dr. Sucheta, thank you very much.
Okay.
So goodbye. Good night, friends.